Welcome to an episode of Global Health Insights. I'm very happy today to have my friend, Dr. Karlee Silver, the CEO of Grand Challenges Canada, on the show. Hello, Karlee.
Hi, Peter. So great to be here. Thanks for having me.
Thank you. And today we're going to talk about the role of innovation in the past, present, and future of global health. Karlee, why don't we just start by maybe sketching a little bit your career journey? Tell us how you got to this point of being CEO of Grand Challenges Canada.
Yeah, absolutely. So it started definitely with a lot of curiosity when I was young. I went into medical science, biochemistry when I was younger, and really just driven by an intellectual fascination of the complexity of the gene and environment interactions and host and pathogen interactions. I was really into like science fiction and infectious disease kind of stuff when I was younger, and also was in Winnipeg, did my undergrad in the University of Winnipeg in the milieu where Frank Plummer and Alan Ronald were doing some landmark HIV research in Kenya, and that was being broadcast within the Winnipeg media scene. In a way that was very influential. So did my undergrad and then went to Oxford, studied genetics and immunology, looking at the genetics of autoimmune diseases. And during that exploration there, I had a great grounding in technical skills and things in that time, but it also really opened up kind of a global look, exploring the origins of the Rhodes Scholarship, being in labor in sub-Saharan Africa, spent a lot of time actually in sub-Saharan Africa and just exploring like what this different part of the world that I'd never really been exposed to. And I was quite drawn to the massive health challenges that were getting very little attention. And I think I remember listening to a speech by Stephen Lewis at the time, The Race Against Time, where he's really articulating the HIV epidemic that was going on and how this was so unequally balanced in emerging economies and in North America and Europe. So that definitely lit a fire on what might be something that actually is very motivating to work on. When I returned to Canada after my PhD, I worked as a postdoc research at the University of Toronto in Kevin Kane's lab, really looking at the effects of malaria in pregnancy, and spent that time understanding the broader context around a woman who's pregnant, who might be exposed to malaria, that can play into whether she has a good outcome or a bad outcome, whether her baby has a good outcome or a bad outcome. And really enjoyed that time. Got exposed to your thinking around the ethics and social and legal cultural elements of health research, which was also quite inspiring and helped expand what the horizon might be. And I honestly felt limited by the academic track. So I was very fortunate and lucky that around the time when I was ready to make the jump from academia and that postdoc track to something else, that you were starting up Grand Challenges Canada, and I was able to come join for some early scoping work, and I've never left. So here I am now.
And here you are, and that's 15 years later.
15 years later. So starting as a consultant and then program officer, and as the organization grew and my own career grew, I'm now the CEO.
Well, that's an amazing career track, Karlee. Congratulations.
Thank you. And thank you for your
yeah, of course. And obviously it's very focused on innovation. Not everyone will think of innovation as a central point of international development. So maybe just talk a little bit about that. What is innovation and why is it important in international development or in global health?
Yeah. I mean, you could have entire series of podcasts about what the definition of innovation is. But for me, the simple thing is that you're introducing a new way of doing things that is leading to a better outcome with the same or less resources going in. And for me, the reason why this is so important in development or really in any sector is the fact that you have to stay relevant. The world keeps changing, whether we want it or not. And the only way that you're going to stay ahead of the times and stay able to address the needs in the context that keeps changing is to innovate. And I also think that particularly in times of disruption and challenge where people are thinking about how are you supposed to do the same outcomes? How are you supposed to have the impact you're looking to have? How do you be more productive as the rules of the game change? this is critical. Taking new approaches, be it science, social, business innovation, and bringing them to bear so that you can have more impact for the money or time or energy that you're spending on something is absolutely essential if we're going to move forward.
Yeah, you made a couple of great points there. One is, sometimes people think of innovation as a piece of technology or a doohickey, but it's more than that, isn't it?
Yeah, absolutely. If you think about some of the technologies that people, or the innovation, sorry, that people often rely on now, we're talking about like the introduction of rideshare apps like Uber or Lyft. That's not a technical innovation. That's not a technology. It's a way people are arranging themselves, the way money is flowing in a different manner that has made the resources that some have, cars, more accessible to many people who would not otherwise use them. So while this is not an endorsement of Uber or Lyft, I think it's a helpful example of where you can bust past the, just thinking about innovation as your next big iPhone or AI related thing. Those can certainly power innovation, but it's also in terms of social elements, how institutions are arranged, how people interrelate, and what are the norms that we behave in.
Yeah, and also implicit in what you said earlier was the importance of innovation at a time of disruption to adopt or adapt to that disruption. This is certainly a time of disruption in international development and global health. So does that mean that innovation is more important than ever now, or it's always been important, or how do you see the timing issues?
Yeah. So, I mean, I'm biased. I think it's always been important. But I do think particularly now we're seeing that be like resonant with a lot of other people that maybe hadn't been focused on innovation quite as much. I would say over the last decade, the understanding that innovation plays a role in global health has certainly gone up. I think a lot thanks to work that you and the Grand Challenges movement and other foundations and organizations have done to raise the profile of what's possible when you allow innovators to focus on the global health challenges in the world. I think that's now being reflected in the strategies and the narratives that emerge from kind of more bureaucratic or larger institutions that work at scale. And I think that's where there's some real excitement from my standpoint, is that innovation is only going to have the impact it can have if it goes mainstream. And that means going to scale. That means being incorporated into platforms that exist at scale. And so it's really important for that broader narrative of where innovation is helpful and not being seen as just a fringe thing over on the side.
You mentioned the Grand Challenges movement. What is that, and what is a Grand Challenge? And tell us a little bit about Grand Challenges Canada, the organization you lead.
Yeah, absolutely. So very simply, a grand challenge is a critical barrier that, if overcome, is going to, for us, in our definition, it's going to advance health or social equity. And there is a movement. There is a number of Grand Challenge organizations. Grand Challenges Canada is one of the first. That is a family, a loose network of organizations around the world. Most of us share a similar focus on enabling innovation for impact, largely focused in global health, and also mobilizing domestic resources, which is pretty phenomenal if you think about the fact that most of the Grand Challenges organizations are based in emerging economies. So Brazil, India, South Africa. And I think there's a real power to the fact that this is a growing network. Grand Challenges Canada itself, it's an innovation platform. We were initiated by the Government of Canada in the 2008 financial crisis. So it's an interesting thing to think about at another point of time where many governments were having to retrench and couldn't consider putting significant amounts of money into an external body in order to provide competition and innovation into a sector that needed it. We essentially support local, sustainable, and scalable innovation to create a healthier and equitable world. And we do this by defining the grand challenges, those critical barriers to health and equality in underserved communities. We provide seed funding through open calls for proposals to innovators with bold ideas to address the challenges. And we transition to scale the most impactful, scalable, and sustainable ones with a mix of financial tools, grants, loans, equity, as well as technical support or non-financial tools. And through this, we help to de-risk what could be a really like bold, risky idea that there's no way should be or could be pulled to scale by public money, and de-risking it so that we know that the innovation has the impact that is outsized compared to what's currently being done. It has a validated path to scale and sustainability, and it has the institutional strength and partnerships that are going to be necessary in order to sustain that impact at scale. And a lot of this also involves having innovators amplify their impact by incorporating gender equality considerations, climate change considerations, etc.
And what type of scope and scale have you achieved at Grand Challenges Canada?
Yeah, so we've funded 1,500 innovations over the last 15 years in about 100 different countries. We're known from those innovators for being the first in often into their innovation. Many times I hear stories about how the people before us to support an idea were the innovators themselves and maybe some family members. We tend to be the first in, and we're also very patient and flexible, and so help innovators get to the point where we're no longer needed and they're way beyond us in terms of the size of funding they can either generate or crowd in, or their ability to be sustained without us.
Yeah, and I want to get into some of those concrete examples in a second, but first I just want to pull out something you mentioned a few minutes ago, which is that Grand Challenges Canada, through this network of organizations and through your work, essentially is mobilizing domestic resources for innovation, for science in low and middle income countries themselves, led by low and middle income country innovators. That sounds to me like something that's a double header. It's not just going for impact. It also is a path to economic productivity and jobs and development in countries. Do you want to just talk a little bit about that? Because I think people are, reflecting now on the sustainability of international development approaches.
Yeah, absolutely. I think it's something that I'm so glad that we put forward as a starting point of Grand Challenges Canada, was that a strong belief that those closest to the challenges are best situated to address those challenges. And that the ability to solve that through that incorporate the financial sustainability, that doesn't necessarily mean they're businesses, but they can run with a lot of the discipline and the mindset of a business with a social output. So 65% of our pipeline is local innovators, and many of the innovations that we support, and especially those who are successful at going through the transition to scale process, have some sort of revenue generating model that allows them to sustain, maybe not continue to grow, but sustain the impact that they're at. And I think that's a critical difference. So there's an exit path from the Grand Challenges Canada platform for any innovator. They graduate and they sustain their work into the future. And that means that they are creating jobs, they are creating businesses that exist in these contexts and that are driving local economies. It's also a very interesting way to be training kind of future entrepreneurs when we have a lot of focus on, especially on the African continent, the number of youth that are there, and thinking about how can we create enough jobs that staying in Africa is a prosperous and exciting prospect for youth. And part of that, lots of people look to entrepreneurship. It's really hard to learn how to be an entrepreneur without being an entrepreneur. And so through Grand Challenges Canada, it's a way to be exposing people to that while also solving a problem.
Great. I think that's a very important aspect, the economic productivity element of it and of innovation. And that separates, in a sense, innovation from other approaches in global health and international development. Karlee, nothing helps people understand what you're up to as much as some concrete examples. Can you walk us through just, one or two or three concrete examples of the work, and just give people a for instance of what you're talking about and what you're doing?
Absolutely. And I agree. This is where all of our work comes to life. And as some of our team likes to say, like we exist for the innovators and we exist because of the innovators. So we're really fortunate to be able to support people who essentially think tomorrow can be a better place or better day than today. And so a few examples. Hewatele is a social enterprise based in Kenya. It started with one doctor trying to address the problem that children under the age of 5 with pneumonia could present at a hospital and not be given life-saving medical oxygen just because the oxygen wasn't available. He thought that was unacceptable and figured out a way to overcome the quality issues and the supply chain issues by creating public-private partnerships with the local governments and a different way of distribution. So essentially, rather than all the oxygen coming from a centralized industrial area in the country and being shipped to all sorts of areas, the plants were small plants that could exist beside a public hospital and provide a consistent and quality supply of oxygen piped right into the hospital. And any excess that the government didn't need or didn't buy, the private sector around that hospital could buy, bringing in sustainability to the model. They've gone from one hospital in the county of Nairobi as their test case, and are now serving over 200 health facilities across East Africa. And I think really getting to the reason of why backing local innovators and social enterprises is a really important angle in global health. During the pandemic, Hewatele was set up 6 oxygen plants in Somalia, 6 out of 25 that were put in at the time. They are the 6 that Hewatele runs are the only ones still operational. Even 4 years later. And the reason for this is they have a built-in model of continuously supporting the running of the plants. They use local engineers that can keep the day-to-day operations going, and they actually care about the brand of Hewatele because they're trying to grow a business, and so it's not in their interest to let something languish. So that to me is true sustainability. They've graduated from the Grand Challenges Canada platform after several loans with a investment round of about 19 million in equity. So that's an example of a business enterprise or business innovation that is bringing quality medical oxygen so that young children don't have to die from pneumonia.
And that's a great example, Karlee. I mean, just to dig into that for a second, because that's not a new piece of technology. That's really an innovation in the business model around distribution, around bringing the oxygen closer to the hospitals. So it's really a great example of business model innovation, and the sustainability point you made was key to that.
Yeah, exactly. And I think the way the oxygen is made, not new. The use of the oxygen in the hospitals, not new. That's best practice. It's really that business innovation that is making it more accessible to people who need it at the time that they need it.
Yeah, just to tease out another piece, the other interesting piece of that was you were talking about the form of capital that you gave to Hewatele. I mean, early on, it might have been a grant to help establish them, but by the end, it was a loan. So this kind of bespoke approach to capital as enterprises grow to really bolster their own sustainability, I think is a key point. That's often traditionally referred to as the valley of death. And you're helping enterprises through the valley of death with different forms of support and different forms of capital as they need it as they go along.
Yeah. And one thing we've realized, there's a lot of talk these days about blended finance and how do you bring different forms of finance together from different sources and in different mechanisms in order to make something go. And it's interesting. It's something we've always done is like, Hewatele got some grant and some loan each time we invested in them. So we're blending it right within GCC, not necessarily needing to have others come on side. Our win is when we have others come on side. And that certainly happened with Hewatele as well. But the power of being able to combine those different tools in one go has been really important for innovators as they journey from being a grant taker to one that is much more disciplined and has a balance sheet that other investors would be interested in.
Great. Let's do another example.
Yeah, so another example would be called M-Mama. This is based out of Tanzania. It started in rural Tanzania, and it was really solving the problems of a very small ambulance fleet that exists in Tanzania. And like most places, that ambulance fleet was focused in urban centers only. So Tanzania, large rural populations. How do we make sure that pregnant women at the time of birth are able to reach the care that they need at that time? So what M-Mama is a cost-effective emergency transport referral system that pregnant women and newborns can use in rural Tanzania that reduces the delays of reaching and receiving care in emergencies. And it relies on a network of community drivers who do the emergency transport with their personal vehicles and get paid per ride. So it's like Uber. And it's interestingly, when we first looked at it and our investment committee first discussed it, there was this whole conversation about like, why would someone use their own car using this? This was obviously before Uber. It was a much harder thing for them to describe what they were trying to do. And it's interesting that they essentially invented Uber at the same time as Uber was inventing Uber, but did it on a very kind of impactful route of how do you get pregnant women to. So we started funding them in 2020 and helped them to transition to scale. And in 2024, they reached national scale in Tanzania, driven by government partnership. So now hundreds of women per month are receiving emergency transport. It's been expanded into Lesotho and other countries. And the government pays directly. That was one of the big things that had to be worked through. How does the government of Tanzania actually disperse very small, like about $1 per transport? Very small payments to the drivers themselves every time that a ride is done. So this is an excellent way. Every time we share this with other ministers of health, they're like, how do we get this into our country? Because it's not uncommon to have a very challenging thing in populations with very large land masses and lots of rural communities to solve that challenge of how do you sustainably support a emergency transport mechanism.
Well, I have a few questions about that one, Karlee. The first one is what's the impact of that at national scale? Of the M-Mama.
So they do about, it's about 4,500 women per year who are coming, and that's growing, that was the first year, who are coming direct to hospitals, preventing maternal morbidity and maternal mortality and newborn mortality right at the time of birth. It's an interesting thing too that they feel like Tanzania has really felt like they've been able to solve for that delay through the use of the data platform that supports M-Mama, that they are able to identify the problem of newborn care as that being the next thing. How do we make sure that the newborns in the systems now are able to get to the life-saving care that they need if they're born too soon or too sick? And so it's really kind of moved them beyond their initial problem set into another important one.
Yeah. And one interesting thing about them is they've had an external evaluation that shows the number of transports are up, the costs are down.
Yeah, exactly.
Amazing. And you mentioned that the government pays. People are very much talking about, well, they've been talking forever about country leadership. Whether they actually really mean it or not, I don't know. But here's an example of maybe true country leadership. Does the government of Tanzania really feel a stake in this? Is this really country-led, country-paid, integrated into the local health system?
Yeah, it's great. It's a great question. I always go in with that same skepticism. I visited the M-Mama team in Tanzania in September last year. After kind of encountering several pieces of the system, I was really interested by the fact that everyone claims ownership over M-Mama. So whether it's the district medical officer that was involved in the initial pilot, whether it's the kind of number two to the Minister of Health who claims the win of having it at scale, there is no mention of external support in it. And that's okay, because essentially now we've got something that is seen as Tanzanian, and it is Tanzanian. It was grown there. It solved a Tanzanian problem, and it's fully owned by the Tanzanian government.
Great. And you also mentioned, when you speak to other health ministers, which at national scale in Tanzania, this is something that could go from country to country and help maternal health, women and children's health. How is that working? And what is that process, often called horizontal scaling, like across countries? And how do we make that better?
Yeah, it's a great question. I think part of the big challenge that's collectively ahead of us as we think about how to pull innovations to scale. This level of awareness generally of what innovations exist in a country when a health minister is trying to solve their own priorities, that needs to be solved for. The ability for ministers not to be solved for So there's some work that we've helped to test out. The WHO Innovation Hub did some work to think of demand across countries and sharing potential innovations for them. There's many other approaches that are happening right now to figure out the best way to do this. But there is fundamentally an awareness within the countries and then peer-to-peer countries that needs to be solved for before you even get into the fact that pulling innovations to scale is still a pretty chaotic and that needs to be systematized if we're going to take it seriously.
Yeah. And by the way, you mentioned WHO. It operates across 194, 193 countries. And it should be in a great position to do that horizontal scaling, don't you think?
You would think. Yes.
You would think.
You would think.
Okay. You would think.
I mean,
okay.
It depends a lot on the value that people place on that role within organizations. We still see a really strong focus on people, like who is in the roles that needs to make this happen. We have someone who really believes in the power of innovation sitting at that country platform. In Somalia, when Hewatele was being procured during the pandemic, 100%. There was a brilliant HO lead there. And that made a big difference. Likewise, if you don't have it, it won't go. So there's something about that and like the idea of innovation being optional or not everyone's business that I think still needs to be solved for.
And I've always thought this should be a key role of WHO because it is very strongly within its strategic comparative advantage and something that can really help speed up impact. The last question I want to ask you about this example, Mama, is you mentioned the investment committee, the Grand Challenges Canada Investment Committee. I think it's really worthwhile just to dwell on that because that's a real innovation in supporting innovation. Do you want to just talk a little bit about where that fits in, what that is, what makes it new and exciting?
Yeah, absolutely. So maybe just to put it in context, when we talk about our seed funding, it's largely calls for proposals that go out, applications come in, it's more of a peer review process, pretty standard approach to grant making. And that's good and it has its place. We've realized that our investment process for transition to scale needs to be much more bespoke. And so it starts with deal leads within Grand Challenges Canada working closely with the innovator to figure out what needs do they have, what are the next big critical things that need to be solved for in order to advance that solution towards sustainability. And then what role can Grand Challenges Canada and other partners play in helping them reach that? After several months of the deal leads working up with the innovation investment case, that's presented to our investment committee, which is made up of a set of people from capital and social innovation, people who have scaled things in the past through public systems, who really sit and look at them and figure out, is this the right lever we could push to solve a big problem that is worth solving? And are we setting them up for the biggest success around scale and sustainability? Are the risks that we're willing to take, are they ones that we can be addressing so that next time around they're less risky and we can crowd in other investors? So that set of people that sit around and they spend a ton of time with us as volunteers. I mean, there's real commitment around that table to addressing these problems and looking at how to support innovators all over the world. They are focused on the scale and sustainability part of it, which I think differentiates us, even though we're impact first. So we're not doing it in the way to get commercial value. The processes we take and such are more aligned to kind of a venture capital approach or an impact investing approach than one of a grant maker.
And that's really the mechanism that ties to what we were talking about earlier, which is the economic productivity, the essence of which is sustainability.
Yeah. If we can prove to ourselves or convince ourselves that by putting this money on the table for an innovator and with their solution, that it's going to leave them stronger even when we're away, like when we exit, it's very rare that we will put the money in. So that idea of like, it's not just a 5-year program that when it's done, the same amount of money is going to have to go back into it in order to get the same outcomes again. It's how do you actually make a catalytic shift between where that solution sits now and where it can be in the future.
And you've always got someone, often a government on the demand side who are matching the funding from Grand Challenges Canada, and you're adjusting the funding, the balance between grants and loans and non-grant finance according.
Absolutely. Yeah, there's an important kind of array of government support, of other philanthropies that are very active in different spaces, and more seeing where development finance institutes and pay on results type of models are coming into play with that same mix of players.
Great. So let's talk now, Karlee, about the future. Grand Challenges Canada is 15 years old. The Grand Challenges movement, if you will, is about 25 years old in innovation and development. What do you see as you look at the future of global health, the future of international development, the future of Grand Challenges Canada, the future of Canada's role in international development? Pick up any aspect of that you want and just tell us what you see in your crystal ball.
Amazing. Yeah, if only I had a crystal ball. But I'll tell you the signals kind of I'm paying most attention to at the moment. So first is from Grand Challenges Canada's perspective, we've set our ambitions. You have to reach 750 million people with life-saving or life-improving innovation by 2035. So that really sets out our ambition what we're going to be doing over the next 5 years. And part of that is a real recognition that we have to play a more active role in that pulling innovation to scale, figuring out that systems part, working deliberately in systems who already function at scale so they can shift from that chaotic kind of uptake of innovation every once in a while and very person-based to strengthening the ability to do that in a systematic way and predictable way. Essentially, like, how do they form markets that can drive innovation, that innovation process into both economic outcomes, but also solving for the social issues that different countries face. So I think there's a mix of that I'll pull out. I think, and part of this is hopeful, and part of this is, things we're going to work towards. I think really bolstering country leadership and understanding which countries are ready to take on the challenge of scaling innovation. And that means really putting their own priorities first and mapping them out in a really specific way, but also figuring out the things that need to be done for procurement and for budgeting that can make that flow. The kind of nuts and bolts that is less sexy than the gadgets that people often think about with innovation, but essentially that is what the next 10 years has to be when you're talking about innovation if we're going to have impact at scale. I think with the Grand Challenges network, we're seeing more and more strength and more countries being really interested in growing their own science and innovation capacities. And that makes sense. If you want to grow an economy, you need to be investing in these areas. So we're really interested in backing those efforts and getting behind different countries who are putting money on the table for their own innovation challenges and using our know-how and support to be able to make that happen. I think when it comes to Canada and the world, I think Canada has real strength, especially around the innovation and innovative finance areas. I think we can be playing an outside role. There's still a few levers that need to be pulled from both government as well as internal coordination in Canada that can really make that go. But imagine in this time of we're thinking about how do we have different trade routes? How do we really form close partnerships with countries that we have not had as close relationships with because of a really strong relationship with our neighbor to the south? That thinking through where does the ability for us to be bolstering new solutions in different parts of the world and helping kind of map new paths for trade and development is an exciting part that I'm definitely paying attention to.
Amazing. And those are all huge benefits. And looking inside Canada, Canada's always struggled with this problem of productivity. Is there anything you've learned that can help innovation and productivity in the Canadian context?
Yeah, absolutely. I mean, I've certainly been exploring this more and more in the last little while, and I heard an interesting stat last week that Canada is the worst tops the chart when it comes to most fearful of failure when it comes to entrepreneurship. And I think some of the thing that Grand Challenge model has been able to do is to give opportunity that kind of lessens the risk for an entrepreneur to take some of that risk. To say hey, we're actually going to give you some money because you've got a great idea to give it a go for a year or two that is actually going to give you you can keep supporting your family. And at the end of the day, you're going to come out with some great skills, even if if your solution doesn't work. So that ability to take a disciplined approach and to have kind of a way to back innovators who are interested not only in money making, but also in social impact in Canada is something that I'm really paying attention to. Starting to find some interesting folks who are emerging around that front too.
Amazing. So, Karlee, just as we're drawing to a close here, is there anything else you want to add?
No, I think just thanks for having me on. I think we're at the start of how we'll see innovation play a big role in the shifting context of global health right now, and I'm excited to watch this space.
Great. Well, that's just amazing work. Congratulations on everything that you're doing. It's so exciting for the world, so exciting for Canada, and so impactful. So thanks for joining us and explaining that. And congratulations, Karlee, on everything you've achieved and everything that you will achieve.
Thanks so much, Peter. Thanks for having me.
Thank you. Okay, bye-bye.